The ADHD pandemic. A restless, easily distracted child is more frequently observed than not, particularly among school-age children. However, when these acts interfere with his or her schoolwork and result in repeated disciplinary action, parents may question whether there is more to this conduct than just children being children. According to the ADHD statistics in our guide below, attention deficit hyperactivity disorder, or ADHD, is one of the most frequent neurodevelopmental diseases among children in the United States. Fortunately, there are a variety of medications and behavioral therapies available to treat children and adults with ADHD. Let us explore deeper. Remember to like this video, comment on it, and subscribe to our channel for more stuff that will undoubtedly benefit you with your health in the future. What is ADHD? First and foremost, let us comprehend what it means. ADHD, or Attention Deficit Hyperactivity Disorder, is a widespread disorder characterized by a persistent pattern of inattention and/or hyperactivity impulsivity that interferes with functioning or growth. Chronic inattention, hyperactivity, and impulsivity are all characteristics of ADHD. As symptoms emerge in early development and academic performance, many children are diagnosed with ADHD. ADHD symptoms can last into adulthood and have an impact on social interactions, academic performance, and job success. How common is ADHD? According to global surveys, the incidence of ADHD is higher in higher income countries. According to the National Institute of Mental Health, the lifetime prevalence of ADHD among children in the United States is increasing, with the most recent estimates putting it at 11%. In addition, according to the study, an estimated 6.1 million American children aged 2 to 17 years old have gotten a diagnosis of ADHD, accounting for 9.4% of this total age group nationwide in 2016. Furthermore, boys are more than twice as likely as girls to be diagnosed with ADHD. The worldwide rate of adulthood ADHD is estimated to be 2.5%. The lifetime prevalence of ADHD among adults aged 18 to 44 years old in the United States is predicted to be 8.1%, with a present prevalence of 4.4%. As a result, we can see that it is increasingly statistically. Statistics about ADHD in children. The proportion of children who are ever diagnosed with ADHD rises with age. According to surveys, 2.4% or 388,000 of children aged 2 to 5 years old and 9.6% or 2.4 million of children aged 6 to 11 years old have ADHD. The median age of diagnosis for severe ADHD is 4 years old and 6 years for mild ADHD. Furthermore, the median age of mild ADHD diagnosis is 7 years old. Teen ADHD statistics. 4.2% of the adolescent ADHD cases had severe impairment. The Diagnostic and Statistical Manual of Mental Disorders was used to develop the impairment criteria. Adult ADHD statistics. According to Harvard Medical School, the prevalence of ADHD among adults in the United States was 4.4% in 2001 to 2003. However, because 85% of children with ADHD will likely have the illness as adults, the rate of ADHD in adults is likely underreported. Because of ADHD diagnostic criteria were originally created for children, the diagnosis of ADHD in adult is developing 4 times faster than ADHD diagnosis in children in America. Research suggests that the majority of youth with ADHD will also have ADHD as adults. According to Harvard Medical School, says Nikishia Hammond, PhD, a psychologist at Hammond Psychology and Associates in Florida. One critical thing for young people to learn is how to manage their ADHD symptoms, which may improve their adult outcomes. Some individuals have reported lesser deficits in functioning as a result of learning triggers and coping strategies for their ADHD symptoms. Some adults who have previously been diagnosed with ADHD have learned to manage their symptoms adequately and no longer satisfy the criteria for ADHD later in life. They would not necessarily meet full criteria for ADHD. They may still have some of the attention symptoms, but not enough to receive a diagnosis, Dr. Hammond said. Most research indicates that ADHD does not truly go away, but adults report fewer symptoms. Hyperactivity symptoms, for example, often decrease with age. Only 11% of individuals with ADHD receive therapy. Furthermore, some individuals may be undiagnosed and hence untreated due to co-occurring mental health disorders that conceal ADHD symptoms. Anxiety disorders account for 45%, mood disorders account for 38%, impulsive control accounts for 20%, and drug addiction problems account for 15%. In the classroom ADHD, Dr. Hammond goes on to say that youngsters sometimes interrupt lectures, which disrupts social connections, and that some teenagers struggle with self-control, which leads to verbal or physical interactions with other pupils. According to the 2014 National Survey on the Diagnosis and Treatment of ADHD and Tourette Syndrome, the majority of ADHD pupils, 69%, got one or more school treatments. Individualized Education Plans or IEPs and Section 504 plans are 2 types of school assistance available to kids with special education needs. Journal of Attention Disorders, 2018. How do we eliminate these things now that we know the state of American ADHD? How will you aid someone who has it if you know someone who has it? Keep an eye out for additional information on this topic. The statistics about ADHD treatment. A mix of medication and behavioral therapy is the most effective ADHD treatment. Typically, stimulant drugs such as Adderall and Ritalin are prescribed initially. If stimulants don't work, a doctor may prescribe a non-stimulant drug like Strattera. These drugs work on dopamine to help patients focus and feel less impulsive. Cognitive behavioral therapy, or CBT, is a popular method of behavioral treatment for persons with ADHD, particularly youngsters. A skilled therapist can educate youngsters on how to express themselves without disrupting other lives. CBT can also help parents and teachers understand how to reward positive behaviors. Thank you very much for taking the time to watch. Knowing this will undoubtedly raise your awareness of ADHD, how common it is in America, and its treatment. What are your thoughts? Leave them in the comment section. We would want to learn more about it. Don't forget to like this video and subscribe to our channel for more interesting health and wellness material. See you in the future video.